What's up, y'all? My name is Danae Reed. As y'all know, I'm here with the Philadelphia Sunday Sun. This is my show, a Millennial Voice, and I've been gone for a little bit, but I'm happy to be back. My birthday was last week, and I had something going on the week before, but I'm back. I'm here, and I am so blessed to be here with my co-host, I guess, for the day, Nia Coaxum Morgan, who is a Black doula, and I am so excited to talk to her because, as you guys know, Black maternal health is so important, and just the doctors are crazy, right? When it comes to the Black woman, and it's all this stuff always going on. And Nia just informed me that Black Maternal Health Week begins next week on the 11th and ends the 17th, so this is super timely. But Nia, with that being said, I'm going to let you introduce yourself, and then we'll get into the show.
Sure, thanks, Danae. So my name is Nia Coaxum Morgan. I'm from Philly, live in Philly, was born and raised here. I am a birth and postpartum doula. So I serve Philadelphia, the surrounding counties, South Jersey, and then like parts of Delaware. I have a master's in public health. My background's in public health. I also went to Westchester, which is how I know Danae. Went there for undergrad and grad school. And I start my new job next week. I currently work for Montgomery County. Thank you, for Montgomery County Health Department in drug and alcohol prevention. But as of next week, I will be working in maternal health for Philadelphia's health department.
That's awesome. Congratulations. I love that for you. So it just seems like this interview is just perfect, like on time.
Yes, like everything is all like coming together at the right time.
I love that. Okay, so Nia, as I mentioned in my introduction, Black women are more likely to suffer complications during childbirth. Is that, did that play a part in why you decided to become a doula in the first place?
Definitely. So the statistic that always sticks out specifically to me is that Black women are 3 to 4 times more likely to die from childbirth and pregnancy-related complications compared to their white counterparts. And this is regardless of education, occupation, socioeconomic status. That statistic is still there. So about 3 years ago, I attended a presentation at my job in Montgomery County on birth outcomes and maternal mortality. And it's focused on specifically like Black maternal mortality. And it wasn't surprising, like I knew it was an issue, but it was just, it was upsetting. So I'm like, well, what can I do to try to address this? I knew that I didn't want to do like the clinical medical side of it. So I didn't want to be a nurse. Mm-hmm. I didn't want to be an OB. And honestly, even if I did at that point, I wasn't going back to medical school. Yeah. So I'm like, what else can I do to try to advance maternal health, but also eliminate these, health disparities that exist. So I mentioned I do have a public health background. I work in the public health field. My degree's in public health. And I've always loved like doing the hands-on work in the community, educating the community on various health topics to improve their health. So I did a little bit of research, found out more about what, the role of a doula was and how they're really beneficial to Black women. And I remember like it was yesterday, I was sitting on the couch and like talking to, my now husband. We weren't married at the time, but I'm like, babe, I think I want to be a doula. And from there, it's been up and stuff. Like it's just been nonstop. It's been perfect.
I love that. So before, you go to this seminar, you really hadn't thought about being a doula?
No. It feels like a lifetime ago because the pandemic's been going on for forever. But so yeah, this was in 2019. Okay. And I had heard of doulas before, but like a lot of other people I know, I kind of used I thought doulas, I used the term interchangeably with midwives. And doulas just, if anyone doesn't know what a doula is a trained professional who provides non-medical and non-clinical support to birthers, to women during pregnancy, birth, and the postpartum period. A midwife is actually, hands-on assisting you during birth. Like, so they're acting as they are the medical professional. Okay. So doulas don't provide any, medical care, clinical like support at all.
Okay. Wow.
But yeah, so before that, I like I said, I use the term interchangeably too, but doing my research, I talked to a few other doulas I knew, especially like locally in Philadelphia. And I'm like, you know what, this is it.
Is it? Yeah. So why do you think that people use doula and midwife so interchangeably? Because I feel like I didn't know that they weren't the same thing until about a year ago myself.
I think just lack of education, and that's not like the, individual's fault, but and doulas and midwives aren't anything new. They've been around for decades, for centuries,
Mhm.
even maybe if doula and midwife wasn't their exact title. But I think people just don't know.
Yeah.
Even my grandma, she's in her 70s and she's like, "Oh, so you would be catching babies?" I was like, "Oh no, this it's similar work, but in a way, there's also like glaring differences."
Right.
So like I said, I'm not checking vitals, I'm not catching babies, I'm not providing medical advice or care, and midwives require much more extensive training than
Okay.
doulas do.
Okay. I mean, that's awesome. Obviously, the community needs you, right? So, how have you seen that you've made a difference in the birthing experience for Black women? Do you only really specialize in Black women?
That's my main focus. I
Okay.
wouldn't say that I only like support Black women. So far, all of my clients have only been Black women.
Okay.
And that's really who, I'm not sure if you've checked out my website or like my Instagram page, but all of like my pictures, graphics are Black women, just
Yeah.
because that is who like, my priority population is.
Okay. Okay. But so I'm sorry, I like asked you like two questions in
No,
one.
it's okay.
So I'm just wondering, like, how have you noticed your impact already being in that doula space? Like, how has your presence, I guess, in your perspective, changed the birthing process for the women that you've worked with?
Definitely. I would say overall, my goal as a doula is to make sure that women and birthers are educated, so they're prepared for birth, no matter what the outcome is, because like other things in life, but especially childbirth, it's unpredictable. You can
Yeah.
plan for one thing and something else can happen.
Yeah.
So, making sure that they are prepared and educated for all possible outcomes, but also, making sure that women are going into birth confidently. I
Yeah.
think a lot of times, and I can even speak for myself, I don't have children yet, but before I became a doula and became educated myself, I was terrified of childbirth just
Really?
because of other stories I've
Yeah.
heard, even from my own family, like, oh, childbirth is the closest point to death, and this happened. And even I think if people do have those ideas from their own experiences, I don't necessarily think that's something you should be telling someone who's
Yeah.
currently pregnant, who's considering having children in the future. But a lot of times our fear comes from not being educated. Like, you fear what you don't know.
Right.
So if you're completely prepared, physically, mentally, spiritually, really get in that mindset to prepare yourself for birth,
Mhm.
then you can go into it confidently.
Right, right. Okay. There's so many things to unpack here. I love this conversation because I've never, like I said to you off the record, I've never had a conversation with a doula before. So I'm really excited that you're here and providing information. So obviously, you've done your research, all these things, right? How do you maintain a sense of calm in such a hectic situation? Like, how do you make sure that you're calm if stuff is crazy going on? How do you make sure that you're the one that's like, okay, like let's just come back to center and just do this? Like, how do you do that?
Really just, trying to recenter myself and remind myself that if anyone does have to stay calm in the situation, it has to be me, because
Yeah.
I'm there supporting my client. Sometimes their spouse is there, their partner. If it's not a spouse or partner, it could be a family member such as their mom, sibling, best friend, really, whoever they want to be there with them in
Yeah.
that moment. And the person actually in labor and giving birth tends to be, stressed,
Mhm.
they're in pain, and then so does their support person.
Yeah.
So I'm there to not only, support, provide education, and provide emotional support, not just to the person in labor and giving birth, but to their partner as well.
Mhm.
Because that can be, there's a lot going on. It could be stressful for them seeing their partner in pain.
Yeah.
They might not know the right thing to say in that moment. They might be exhausted as well.
Yeah.
So just really remembering that, like, okay, if anyone has to stay calm, it has to be me. And
Yeah.
plus, I'm there to not make decisions for them, but just remind them of their birth preferences that we've previously discussed, and any education I've provided ahead of time, just reminding them, so that they can make decisions that are best for them and their family in the moment.
Okay, so like let's say before birth, you have this conversation with this person who's pregnant, about to have a baby soon, and they're like, okay, absolutely no epidural. and then they get to the hospital and it's time to have the baby and they're like, oh, I changed my mind, I changed my mind, I changed my mind. So in that circumstance, would you insert yourself and be like, hey, like, remember this is what we talked about? Or like,
Yeah, definitely. Yep. So I do remind them of their preferences, but usually we come up with an agreement ahead of time, a code word, a certain look.
okay,
So far I haven't had any clients who were like hard set on no epidural. They were like, I would like to try this natural, but if I get there and it's too much and I change my mind, I'm okay with it. I do have one client whose estimated due date is coming up at the end of this month, and she's a hard no on an epidural. She does not want one at all. So I did ask her that at our last prenatal session. I'm like, so, when you get there and if you feel like you can't cope with the pain and you're asking for an epidural, what do you want me to do? How would you like me to handle that? And she's like, just remind me, give me that look. We came up with like a code word for if she does really decide that she wants it, but she understands that like now she's saying no, she doesn't want an epidural, and that even when she gets to that space and she's in pain and like her mind and body are saying give me the epidural, she's still saying in the back of her mind like I do not want one at all.
okay.
So yeah, usually we discuss that ahead of time.
Yeah, and I've noticed that it's more common now for people to be like no epidural at all. So
Definitely.
okay, awesome. So my next question to you is it just about what you talked about earlier with the partners and the other support system in the room. Is there any clashing ever, like with the doula and the partners or the
I haven't personally experienced it. I'm sure that, other doulas and partners have, had that experience before, but usually my first time meeting the partner or other support person isn't in labor.
in labor?
I've met them previously, whether it was during my consultation or I really, hope that they attend the prenatal sessions because it is like a team effort. Like it's not myself and the birthing person against their partner, but more so like me coming into your space and I'm like the third party, but like we're all working together as a team. So I really do try to like make sure I get to know them before before the last minute. So usually I've known them for like weeks, months at a time.
Okay. Oh, good. So it's like that repertoire is kind of already just built in.
Yeah,
Like
by the time we
it's
get
like
to birth, I've been working with somebody for months. So
okay. Okay. So how typical is it, or I guess what's the average time frame that somebody's going to contact a doula? Like, is it month 1, 2, 3? Like, what is that process like? Or does it
really the earlier the better. Most of my clients have reached out to me and we had our initial consultation when they were still in their first trimester.
oh wow.
I think I had one client who reached out and she was in her second trimester already. I haven't had anyone reach out to me when they were like closer to their due date or in their last trimester, but I have heard that, people have hired doulas
Like last
1 week before their estimated due date last minute. I'm either because like, maybe they had some complications come up and then they realized that they needed that extra support, or maybe they just found out about doulas. But most, in my opinion, the earlier the better. So you can have more time with your doula to, build that relationship, get comfortable with them, but also so you can get in, all of your questions and concerns and make sure that like everything you want to know about can be covered.
right. That's so beautiful because you're seeing it, in most cases from the beginning of the process to like the end, or I guess the new beginning. So what is that like for you seeing somebody through their entire pregnancy and then seeing them come out with this amazing little baby?
I love it. I feel like I'm a part of their journey, and I'm always like truly honored and blessed that they have chosen me, because they can go with another doula. But also like, birth, not even just birth, but pregnancy itself is really like a sacred moment. Like you're
Yeah.
vulnerable, it's very intimate, everything is out there.
Yeah.
Not just physically, but emotionally as well. So it's always very fulfilling when from that first consultation, and it starts off as like a more professional relationship, but then as I'm with them, I notice like, my clients start to loosen up, and some of my clients have become friends even.
Oh,
Like, we still keep in contact, and talk about things other than like, just birth, pregnancy,
yeah.
how their kids doing, but like the rest of their personal lives too. So it is really special to see the growth in our relationship from when we first meet, to our prenatal sessions, to when I'm actually there supporting them physically in birth, and then to the rest of their lives.
Yeah, that's beautiful. So earlier you mentioned a little bit earlier you mentioned the selection process that somebody could go with a different doula. What does that look like for somebody who's choosing a doula? Like, is it an interview process? What does that look like?
Yeah, so it's actually recommended for potential clients to meet with and interview multiple doulas,
Okay.
just because doulas have different niches, different specialties, different levels of experience. For example, someone might want a doula who is more holistic.
Okay.
Someone might be interested in a doula with a certain religious background if they have, certain like religious beliefs that they want to follow through their
Okay.
pregnancy and birth. So it's recommended to interview multiple doulas. Myself and most doulas I know offer, a free introductory consultation. Some doulas call it a discovery call. Some doulas just call it like an introductory meeting.
Uh-huh.
Just to meet with the potential client, find out more about them, what they're looking for in terms of the doula support. And then that's our chance as doulas as well to tell them about the services we offer, and how we can best support them.
Yeah, and like I was saying earlier, I feel like doulas have become so much more popular within the past 10 years. I had never heard of a doula ever. I had heard of a midwife, but I had never heard of a doula until
Mhm.
about a couple years ago. So it seems like you kind of got in at the right time. So how are you balancing everything that you're doing on top of being a doula? Because I can imagine for you that's also a little bit draining as well. You know, it's mentally taxing. You're putting your energy and efforts and emotions into making sure that somebody else is sane. So how are you staying calm and sane yourself, but also how are you balancing everything?
It's definitely a lot. So I've been a doula for about a year, and I launched my business officially in June
Hmm.
of last year. So I'm coming up on a year of Birth with Purpose being in existence.
Hmm.
But I also do work a full-time job. So I work, 8 to 4. When I have to attend births, I
Hmm.
call out of work because when someone's in labor, not, I have to go join them. I strategically try to like save my vacation, PTO time for that. But it's also really helped me just to be more organized. Like, I have to, I attend prenatal sessions with my clients. So we have prenatal sessions, and then I have to plan for postpartum visits. So
Okay.
just, really making sure that I stay on top of my schedule, and then my clients also like can reach out to me like at any time during the day. But all of my clients and like potential clients do know that like, I work and I have like other commitments. So they're
Yeah.
pretty understanding that I might not respond like as soon as they text me.
Right, right. Okay. So has there been any circumstances that like reaffirmed why you do what you do? Like just one moment that like meant so much to you that you were like, this is exactly why I do what I do. And if so, can you just share one story?
Definitely. So as you and everyone else knows, we've been in a pandemic for what feels like forever.
Hmm.
One of my clients' births, I was not able to attend in person.
Okay.
This was shortly after the holidays when there was a COVID spike. So the hospital, literally the day before she went into labor, the hospital had just changed its visitor policy where you
Mhm.
could only have one person. So previously the policy was you could have like one support person and a doula. The
Okay.
day she gets, she goes to the hospital, they're like, oh yeah, we changed that because of rising COVID cases. So I supported her as best as I could, through text, through FaceTime. Everything went fine. She was healthy, baby was healthy. She stated she had a good experience. And I felt bad that I couldn't be there. Like it wasn't my fault, but I wanted to be there physically in person to support her. And
Right.
after she gave birth, she told me that even though I wasn't there physically, she said our prenatal sessions helped. She was educated and she was confident, even though I wasn't there.
Oh,
And I was like, you know what? I'm over here pouting because I couldn't be there in person, but that's my goal. She was confident. She knew everything that the doctors and nurses presented her with. She, could she could ask questions and she wasn't confused about anything. And she said she was really confident in the moment. So
mhm.
that really touched my heart. Like, wow, like, okay, I wasn't there, but everything we talked to and prepared for leading up to the moment still like made a difference.
Oh,
And
I
that's all I can ask for.
much. I love that. Yes, even though you weren't there, the work that you did on the front end made her feel prepared. That's so
Mhm.
beautiful. Wow. Okay. Well, so when I was researching doulas a little bit, the World Health Organization says that they recommend women have doulas. Um, before and after. And I noticed that you also said that you do postpartum doulaing as well. So what does that look like?
So postpartum, I think I always tell people it's whatever mom needs. So it's kind of like nannying, like, I can show up and assist with newborn care if they like,
Mhm.
helping to feed the baby, whether that's, if you're formula feeding, I can help feed the baby, or if you're breastfeeding, I can assist with like cleaning pump parts and providing like breastfeeding education. It also includes, just talking, unpacking about how you feel like your birth experience was, how postpartum was going. So, being there as a listening ear, providing light household chores. I can throw a load in, help with the dishwasher, meal
Wow.
prep.
So you're just amazing.
Yeah, I tell clients and potential clients that when it comes to postpartum, I just kind of show up in whatever way mom and the family might need.
Okay.
I can assist, with siblings. I can't like be left alone with, siblings, but assist with like sibling care as well. So it's really personally tailored and individualized to whatever, the family needs in the moment.
Okay. And how long does that typically last when you do the postpartum doula?
So in a part of like my birth package, each client gets 2 postpartum visits. And I
Okay.
typically try to do the first visit within the first 2 weeks of birth, but of course it's completely up to them. I can come sooner than 2 weeks, I can come later than 2 weeks. It's just that I try to get that first visit within the first 2 weeks. And then try to have the second visit completed within 8 weeks of the baby being born.
Okay.
But if someone were to hire me just solely for postpartum support, it's really whatever the family needs, whatever time frame they would want me to come. If it was, shortly after the baby was born, or if they, realized maybe that their partner or spouse was going back to work and they wanted me there at that 8 to 12 week period. It really just depends on them.
Okay. Okay. Wow. So how does somebody find you or even other doulas alike? Like, what is the process of finding a doula? Is it websites? Can you Google?
Yeah, definitely. I always say, I mean, as I'm sure we're internet kids, like all about social media and technology. So a simple Google search, whatever area you're in, Philadelphia doula, Philadelphia birth doula, postpartum doula. A lot of my clients have found me through Instagram, just through hashtags.
Oh, cool.
Philly doula, black doula. Someone actually found me on TikTok, which I was shocked about. And then word of mouth too. Chances are that you know someone who utilized the doula, or a friend of a friend has utilized the doula.
Wow.
Um, and then there's websites like doulamatch.com, which is kind of just, a database that where doulas can list themselves and their businesses as well. And then there's some organizations that provide community doulas free of cost to potential clients.
Okay. Okay. So earlier you said, you mentioned that before, learning all that you've learned to becoming a doula, you might have been a little bit more scared about childbirth. Has anything else changed your perspective, I guess, on the birthing process outside of just not being as scared?
I think I'm leaning myself whenever I, do get pregnant and have kids. I think I'm leaning more towards a home birth. Just
No, me
because
too.
I say that now. I of course, when I actually do get ready to have a baby, I might change my mind as a first time mom, but first time moms, have home births as well. But before, and I think a lot of times in like media and society, the hospital is all we know.
Yeah.
Because for the most part, that's what's shown. But people have been having home births since like, the beginning of time, before
Right.
hospitals were even a thing. So I'm like, why not go back to that? If we can, if we have the access to it, if there's no like extraordinary like circumstances or complications. So that's definitely something that I've been considering. I don't think I want to like give birth in the hospital.
Right.
I want to be in my own home, or even like a birthing center maybe, but somewhere that's just more comfortable and like a more homey atmosphere.
Okay. So do you think you would ever be doulaing? Is that how I would say it? Doulaing? Being a doula?
Kind of, yeah, that's usually what people say.
Do you think you would ever do it full time?
That's my long-term goal.
Okay.
Like I said, I am starting a new job next week, and it's in maternal health, which is, my passion. So I'm
Mhm.
looking forward to, starting this new role and like being here for a while. But in the long term, I would love to, be a doula full time.
Awesome, awesome. And so my last question to you is going to be, how do you become a doula? It sounds like there's so many components to it, the pre, the post, the during, like there's so many different components. So how does one become a doula? What does that training process look like?
Definitely. So I would first suggest to someone to make sure they just like have a full understanding of the role of a doula. Like, do your research on what it consists of. It is a very rewarding and fulfilling role, but it's also physically tiring, can be emotionally draining, and it may not be for everyone's lifestyle.
Yeah.
And to me, I don't really think of it as like a job, but more so, like a calling and, like I said, a passion of mine. And you really do have to, like, be passionate about this work and have compassion, since you're working so closely with people during like intimate sacred times.
Mhm.
But first I would say, like, research doula trainings. There are a bunch of different organizations out there. So thinking about what you want to get out of training and, like, what your personal values are. And you can also ask around to other doulas that that's how I kind of landed on my training organization, Birth Arts International, by speaking to other doulas I know who took their trainings. But there are more holistic trainings out there. Think about if you want something that's in person that, is more self-paced and self-taught, or if you want a mix of like a hybrid training. But some trainings are 6 to 12 weeks long. Some are like an initial like in-person weekend, and then the rest of the coursework you're doing on your own. Definitely a lot of reading, submitting assignments. But yeah, I would say like everyone's training organization is different. And then it kind of depends at like the pace that you go on. You
Right.
go like, your own pace.
Okay, okay. And what's one tip that you like to give new moms?
To give themselves grace.
Hmm.
Just, it's a new experience. And even if you're not a new mom, each pregnancy is different, each birth experience is different, each postpartum period is different, just to give yourself grace and take it, one day at a time.
Awesome. Well, thank you so much, Nia. Is there anything that you wanted to talk about that I didn't cover?
Um, no, not that I can think of. I feel like we covered a good amount.
Yeah. Okay. Awesome. Well, before we go, tell everybody where they can find your services. I would love for you to drop your website, but also your Instagram as well, and your
Oh yeah,
TikTok. It
definitely.
sounds like you might be the next.
I'll drop it all. So my website is birthwithpurposedoula.com, and then my Instagram is at birthwithpurpose.
Okay.
My TikTok isn't really connected to my doula business, so I actually don't remember the name because I only watch videos when they're. I
Okay.
forget my TikTok name. I can send it to you later. And then
Okay.
I'm also on Twitter as well at birthwithpurpose.
Awesome, awesome. Well, Nia, thank you so much for joining us and talking to us a little bit about what a doula is. I think, like I said earlier, some people are kind of confused that it's not necessarily or not, it's not a midwife. So I think people are confused by that and don't necessarily know what doulas are or the significance of them. So thank you so much for coming on here and being candid about your experience. And I hope this brings you, some new people. I feel like a lot of people are popping out babies lately. So hopefully, yeah,
Definitely a lot of pandemic
a
babies.
lot of pandemic babies. I'm like, I guess we're still in a pandemic because I keep seeing I keep seeing it. But thank you so much, Nia. And I also want to thank you guys so much for watching an episode of a Millennial Voices show here with the Philadelphia Sun every Sunday at 2 p.m. I know I keep taking these breaks from y'all. I promise I'm a chill. It's just been a crazy year, but thank you guys so much for rocking with me. And also, if you want to check out my articles, check me out at www.philasun.com. Or you could also get the article, the full paper in print for only $40 a year. Nia, thank you again so much for being here, and I will talk to you soon.